my powerful posse, and welcome back to Purple RX, my channel. I am Renata, your friendly and resourceful PharmD, here to help you navigate through this vast health and wellness world with all this information and everybody trying to tell you what you have to do, what you're supposed to do, how you're supposed to do it, when everything is not for everybody and everybody is not for everything. So I'm just here to help guide you through to figure out, is this really for me? How do I figure that out and how can I go about it? And you know what today is? Today is Mondays. So on Mondays, we talk about minerals. And minerals are essential for the body and the way it functions. And I want you to know the importance of these minerals so that you know the importance of fruits, vegetables, whole foods, and making sure you get enough of those so you can get the minerals your body needs for it to function at its best, for it to function properly, do what it needs to do, give you what you need to do, give you the power you need in order to conquer your day, conquer your purpose, conquer whatever plan is for your life. So today's Mineral Monday is about iron. And I know everybody's like, I know what iron is, I know what it does, and I kind of know where to find it, but there are some things some people don't know, or how to look at it when it comes on your chart, or what you need to be aware of, or even what you need to ask your doctor if something goes low, and why is it going low? Because you want to know that information too, and know what you need to watch out for, because sometimes some doctors will say something, sometimes they won't. Sometimes they won't because they're not that concerned the first time, but it should be something that you may be concerned with or you need to watch out for yourself. So iron is a mineral and an essential component of hemoglobin, basically red blood cell hemoglobin, which is probably about 70% of your hemoglobin, and myoglobin. And hemoglobin is protein in red blood cells that helps to transfer oxygen between your lungs and your tissues, while myoglobin is the protein that are in muscle cells that carries and stores oxygen in muscle cells. So iron supports muscle metabolism, healthy connective tissue, physical growth, neurological development, cellular functioning, and synthesis of some hormones. So cellular functioning is functioning on the cellular level, like when you have your nucleus and all that, and all those little mitochondria and things that are needed. Iron is needed into those functions, and it's needed in that part of your cell. The smallest part of you needs iron. So 3 to 4 grams of elemental iron is in adults are usually stored in your hemoglobin, in those red blood cells. And that is the oxygen transferring that we probably all learned when we were younger, or we started to learn, however you decide. However, it's come into your grasp and into your brain and thought process. The rest is usually stored in a form of like ferritin. That's why in your liver, your spleen, and in your bone marrow, and also in your myoglobin is where you're going to find that elemental iron. That's why if your spleen, people can live without their spleen because there's other places and other ways to actually to actually store that iron. So also, we typically don't everybody's not losing a whole bunch of blood a day. A lot of people aren't. The only ones that probably are females. So typically you're having a loss of actual elemental iron within your urine, some within the feces, GI tract, skin, but the greatest loss, of course, is in women, women of menstruating age. So those when they start their period to however long it goes, a lot of times 35, 40, later 40s, 50s, some people keep going. So that is where you're going to, most of the time, when you see anemia, it's really going to affect women more than it will affect men. And it will affect people that have come into disease states or have some kind of chronic disease that is affecting their blood either not being made, or you're losing a lot, or you're not getting enough in your nutrition. But that's a later on in the talk. Excuse me. So your serum ferritin concentration, remember, that is the form that's stored in your liver and in your blood, and also in your serum. So the serum ferritin concentration is a measure of the blood's iron stores. So it's the most efficient and cost-effective way for diagnosing iron deficiency. They also can look at your hemoglobin concentration, which you get just about every time you go to the doctor, and a lot of doctors can tell and look at it from that way. But they also, like I said, if they see it within your hemoglobin, they're going to go ahead and take a serum ferritin concentration test to make sure that what they're thinking of is correct. So if you have a serum ferritin concentration of less than 30 micrograms per liter, that can suggest that you have iron deficiency. or you have inadequate iron. Now, when you get to less than 10 micrograms per liter, that's when you're getting to iron deficiency anemia. And that's when your blood levels and hemoglobin levels, the iron within those will be really low. So inflammation can also influence serum ferritin. So a lot of disease states that cause inflaming, a lot of tissue inflaming. If you're eating a lot of foods or something that can inflame and irritate your actual gut and bowels areas, sometimes that can decrease absorption, which can also affect you not getting enough iron or having malabsorption of iron. Okay, but we'll get to that. I'm just going ahead too quickly for you guys today. So hemoglobin concentration. Now this one you can really look at. A lot of times hemoglobin concentration, it's going to be actually within your blood work. You'll see WBC, white blood cell count, red blood cell count. You'll see your hemoglobin. Those all things are going to be within your whenever you go to the doctor and you get your blood taken and they come back with tests. Most of the time those will be in there. So those concentrations, when you're looking at a concentration that's 11 grams per deciliter less, 11 grams per deciliter or less, in somebody that's 10 years or younger, that's what'll suggest that that person probably has an iron deficiency anemia, that child. Now, if it's in adults, it's going to be 12 grams per deciliter. So if you see 12 or lower, then you should know that you're probably going to, it can suggest that you're going into iron deficiency anemia. And they'll want to do a little further more tests to see where that's coming from, where that's happened, or figure out if you know what's going on. So groups that are affected and groups that are at risk for iron inadequacy, close to iron deficiency, or iron deficiency anemia, of course, are going to be pregnant women. Well, not always, of course. Sometimes in pregnant women, there's going to be a deficiency. If there's a deficiency increase, there is going to be a deficiency in an increased risk of a maternity and infant mortality if the mother is not getting enough iron. If she's not eating enough in her diet or not getting enough supplementation, then that can cause a deficiency in the mother as well as the infant and increase the rate of mortality. It can also give premature birth and be a part of low birth weight. That is not the only way low birth weight can happen, but it can also be a part of those. Those are people that are more at risk. Also, infants and young children that basically were preterm or had low birth weight or didn't get enough of the iron and their mother had iron deficiency, of course, they can come out with iron deficiency. Or even full-term babies that are at risk because maybe they're not getting enough in their diet or they're not getting enough, a right amount of solid foods. If you're not giving your children the right solid foods, then they may not be getting that as well. Maybe as grains or as things, because those things are fortified with iron. Even Infamil and all those powdered milks that have come up have been fortified with iron and all the nutrients that they need. Now, also women with heavy periods, of course, because heavy menstruating means you're losing a lot of blood, so you're going to be losing a lot of that iron content. People that donate blood frequently, so every 8 weeks, a lot of people are allowed in the United States to donate blood up to every 8 weeks. Because within that time, your blood starts making it, but your blood may not be making it as quickly sometimes or catching up with the speed of how much you are taking out. And so a lot of those people can end up, I'm going to say about 20% or so can sometimes end up with an iron inadequacy or an iron deficiency in some way. People with cancer, 60% of people with colon cancer have become iron deficient because of malabsorption and because that they're not getting enough within their diet or enough is not staying. There may be bleeding from surgeries, people with GI disorders, people that have GI surgeries because of the bleeding and the tearing and the scars and the absorption and what's been the healing of the actual GI not allowing to have great absorption. Also, a lot of people with heart failure, up to 60% of people with chronic heart failure have a deficiency in iron, and about 17% of them have iron deficiency anemia. So now there's another way that a lot of people become iron inadequate, excuse me. I just can't get my words out today. Maybe because I'm trying to race through them so quick. So anemia of chronic diseases. Things like inflammatory diseases, that could be IBS, irritable bowel disease, rheumatoid arthritis, infectious diseases, and even neoplastic diseases. Because when you have infectious or infection, that usually includes inflammation, or it includes your body putting so much work to try to get rid of that infection. It's sometimes it's taking away from the stress of that iron, or of iron and blood and things not being produced in the best way. Also in neoplastic diseases, so like that would be something like a hematologic malignancy. Basically, you're not making enough blood. You have low erythrocytes, low red blood cells or low blood cells, and or you're not making enough erythropoiesis or erythropoietin, basically that hormone that goes to your bone marrow to tell your bone marrow, hey, let's make some more blood. We need this blood. We need to start getting it. We need to start getting it pumping. If you're low on that, which is in diseases like kidney diseases, adrenal diseases, those things are, and some other hormone diseases can sometimes do that and give you a decrease of erythropoiesis, which can go into an iron deficiency anemia or anemia of chronic disease. That was something that I experienced within my own disease. So what are great sources of iron? You're going through all this. What are great ways to get iron? Now, iron comes in dietary form. It comes in two ways. The two main ways are heme and non-heme iron. So plant-based foods and iron-fortified foods, they're going to be the heme only. While meats, seafoods, poultries, a lot of those things that are higher in protein have both forms. Excuse me. So breakfast cereals, oysters, white beans, dark chocolate, beef, liver, cooked lentils. Those are great sources of protein. Cooked spinach, tofu, kidney beans. Did I say sardines, chickpeas, baked potatoes, breads? All of those things are going to be great sources of iron. Now, if you're a patient if you're somebody that wants plant-based foods and is on a plant-based diet, you're going to have to intake a lot more of those plant-based foods, because a lot of the iron in those, like in vegetables and spinach and all those, they're great sources of iron, but they also have polyphenols in it. And polyphenols and the phthalates are iron absorption inhibitors. So it doesn't allow as much iron to absorb. You also, if you're wanting to take any supplements, or if you're wanting to, even just within the foods you take, taking calcium, be careful, because calcium can inhibit the absorption of iron within the body. So if you're taking supplements, a lot of times the doctor will tell you do not take your calcium supplement at the same time that you're going to take your iron supplement. So I would say probably 2 hours before and 2 hours after. That's usually your best bet. Or if you're taking your calcium supplement, then maybe during the day, maybe earlier in the day and one in the afternoon. Those are going to be your best bets, but you want to keep them separate. So how does supplements look? Say you are a plant-based, or you don't eat as much meat. What other ways can I get the heme and non-heme form, or sources of iron that are needed with it for me? So supplements are good. There are a lot of multivitamin and multi-mineral supplements with iron supplements, especially for women. They're going to have your 100% daily value of iron. So 18 milligrams of iron. And sometimes you have to be careful, because some iron supplements that are iron only have up to 65 milligrams, and that might give you more than you need. Because most of the time the body is going to use and excrete probably about 10 to 15 milligrams of iron on a daily basis, 10 to 20 exact. Actually, that's what it's going to use on a daily basis. The other is stored and put away for other times and other needs, as blood is being transported, moved, however it goes, menstruation, all those things, put aside for those times. And your supplements, you're going to see so many forms. You're going to see supplements comes in a ferric and a ferrous form, but also there's like a citrate, there's a ferric citrate, a ferrous sulfate. There's so many other forms that it's going to come in. But those are the main iron salts that are going to come in. But the ferrous is what you want to look at, because that's going to have a higher solubility. So that's going to basically dissolve better within your blood, within your system, and it's going to be more bioavailable. So it will get more absorbed and better absorbed than the ferric form. Now, what you do also want to watch out is, because there's going to be some side effects. Now, high doses of iron, if you're getting 45 milligrams a day or more, it can cause some GI upset. So you may get some constipation, some nausea, and it's mainly GI effects because that absorption is a bit much on the stomach and the liver. So those are things you want to watch out for. Now, there's one other source that you can naturally get iron from: cast iron skillets. I know in the Black community, that's what we cook for. That's what we know. And cast iron skillets are a pretty good way to get iron within your food. Now, the best foods that are going to be best absorbed, especially based on a 1986 article by the American Dietetic Journal. And they talked about how cooking with iron and cooking in a cast iron skillet can actually infuse your foods with plenty of iron. The more iron, the longer, the more acidic, let me get this together. The more acidic and the more moist, basically the more moisture liquid that is going to be in that dish, the higher absorption it will have, because they stay longer within the pan and the liquid allows it to absorb and get more of the iron out of the dish. So things like stews, soups, chilies, things like that sit there and stew and that you're stirring a lot because you're scraping them out of that pan, that is going to be more likely to get into your foods and be infused into your foods. Now, if you're making things like hamburgers, some cornbread, stuff like that, it's not really going to do that in those instances, because in those instances, they're quick flips, or they're not being stirred enough, or it's a thicker consistency, so it's not allowing to be able to cook in there. So maybe even a little cabbage. Cabbage will be infused well in those dishes like that in cast iron. So throw your dishes in some cast iron. Make sure that it is clean, and the newer it is, the better it is going to be. So make sure to keep your cast iron clean, keep it up to date, and if you need to, replace more or get it cleaned or get it re-seasoned. So thank you guys for joining me. You know it's Mineral Monday. Remember, everything is not for everybody, and everybody is not for everything. I thank you guys, whoever's watching. I thank you for just taking your time to come listen, come join, come see what I'm talking about. And don't forget to like, share it, subscribe it. Please subscribe. I'm trying to get to a goal of at least 1,000 people so we can talk about some more things. I do have a Weed Wednesdays. If you want to talk about more than marijuana, we can talk about psilocybin. We can talk about other drugs, things that affect us. I'm here and I'm open to talk about whatever you'd like to talk about, or go through whatever you'd like to go through. That's what I'm here for. Thank you guys. You guys have a nice day. Bye.